They saw a janitor, but behind the silence stood a surgeon. Respect isn't always spoken. Dignity doesn't raise its voice. Sometimes, it walks in calm steps and speaks only through action. One breath at a time. One heartbeat saved. The mop and the misjudgment. The hallway smelled like antiseptic sharp, sterile, almost sour. Somewhere down the corridor, a heart monitor beeped steadily. Overhead lights buzzed faintly, flickering just enough to cast restless shadows on the tile floor. Dr. Elena Johnson stood at the scrub sink, sleeves rolled to her elbows, washing her hands with calm, precise movements. The warm water rushed down her fingers in steady streams, swirling soap and silence into the drain. Her face was focused. Her breath was measured. She had a surgery scheduled in less than 30 minutes, a complicated aortic valve case that could turn critical in seconds. Behind her, footsteps, quick, careless. A nurse passed by without making eye contact. Pushing a cleaning cart, she shoved a mop into Elena's hands without slowing down. "Clean up room 5, please," the nurse muttered, already halfway down the hallway. Elena looked down at the mop in her hands. She said nothing. She didn't argue, didn't correct, didn't explain. She simply placed the mop aside gently, without drama, and continued scrubbing in. She had work to do. Minutes later, the hospital would erupt in chaos. A code blue. Emergency in OR2. Panic. Scrambling. Shouting. And the woman they thought was a janitor would become the only person who could save a dying man's life. But none of them knew that yet. In that moment, all they saw was a black woman in scrubs, standing quietly by the sink, doing nothing to challenge their assumptions. They didn't know who she was, but they were about to find out. The hallway buzzed with quiet movement pagers blinking, nurses murmuring, carts squeaking against polished floors. Dr. Elena Johnson walked calmly down the corridor, each step steady. Her ID badge clipped neatly to her chest. Her navy blue scrubs still carried the faint scent of starch. She held her head high, shoulders back, chin lifted just enough to show she belonged here even if no one else seemed to think so. 2 nurses passed her on the left, whispering as they moved. Who's she? Not sure. Maybe new janitorial staff. She's walking toward the OR. That aloud. They didn't say it to her face, but they didn't have to. Elena had heard versions of it all before, at every stage med school, residency, even as a licensed surgeon. People rarely said the word, but the assumption was always there. Too young, too black, too female, too wrong. She didn't flinch. She didn't break stride. Outside the surgeon's lounge, a white intern leaned lazily against the doorframe, early 30s, coffee in hand, stethoscope slung around his neck like a trophy. He raised an eyebrow as Elena approached. He smirked. Wrong door, buddy. Elena stopped just for a moment. Their eyes met. She didn't respond. No smile, no reaction, no hint of emotion. She simply reached for the handle and walked inside. Behind her, the smirk lingered like a joke with no punchline. Inside the lounge, the air was thick with unspoken questions. Conversations quieted, heads turned. One doctor leaned toward another and whispered under his breath, "Guess janitors are getting scrub tops now." No one said hello. No one nodded. No one called her doc. Elena ignored them. She moved to her locker, unlocked it smoothly, pulled out a slim black binder, her prep notes for the day's surgery, the aortic valve replacement she'd spent the last 48 hours reviewing. High risk, high pressure. She knew the patient's anatomy better than her own palms. They had no idea she was the lead, because no one had bothered to ask. She didn't care. She didn't need their permission. She only needed the operating room. And soon, very soon, that room would speak for her. The coffee machine sputtered and hissed as Dr. Elena Johnson filled a small paper cup. Her hands moved with calm precision, no shake, no rush. Behind her, someone walked by and tossed a crumpled paper towel toward the trash bin. It missed, The wad landed near her feet. The man didn't stop, didn't say a word. He hadn't thrown it at her, but he also hadn't cared where it landed. Elena stared at the paper for a brief second. Then she stepped around it and kept walking. She didn't pick it up. She didn't owe them that. In the far corner of the room, Dr. Halpern looked up from his tablet. Late 50s, senior attending, silver hair, highly respected. His eyes flickered as he recognized her. His lips parted, as if he might say something, but then he closed them again. He said nothing, just like always. People like him, the ones who knew they were often the quietest when it counted. Silence was safe. Silence didn't make enemies. Silence let things slide. But Elena didn't need anyone to defend her. Her presence alone, calm, composed, unbothered, was enough to make people uncomfortable. She took a sip of her coffee, bitter, hot, checked her watch. Surgery in 20 minutes. She adjusted her scrub cap, tucked the binder under her arm, and walked toward the door. Every breath she took in that room was an act of defiance. Every second she didn't explain herself was louder than the whispers that followed her. Let them talk. Let them wonder. The operating room didn't care who they thought she was. The operating room would tell them exactly who she really was. The hospital pulsed with routine heels clicking, charts rustling, monitors humming. Then the silence cracked. Code blue, or 2. Repeat. Code blue, or 2. The intercom buzzed with urgency, and for a moment, time held its breath. Then chaos. Footsteps thundered down the hall. Voices shouted. Rubber soles squeaked against tile. Carts wheeled by in a blur of metal and adrenaline. Inside the surgeon's lounge, the atmosphere snapped. Coffee cups clattered. Chairs scraped backward. Conversations died mid-sentence. Faces turned toward each other. Some confused. Some panicked. "Who's on call?" one of the younger doctors asked, voice tight. A nurse answered quickly, already typing into her phone. "Dr. Singhal, but he's off-site 15 minutes out. Minimum." Someone cursed under their breath. That patient doesn't have 15 minutes. The air grew heavy. No one moved. Not the intern with the smug smile. Not the ones who whispered about janitor scrubs. Not the seasoned attendings who'd once questioned her place. They stood frozen, each waiting for someone else to step forward. Each terrified to be the first to fail. Then from the back of the room, a voice, clear and calm. "I can." The words landed like a scalpel through panic. Heads turned, fast. And there she stood, Dr. Elena Johnson, framed in the lounge doorway, backlit by corridor light. Her posture was relaxed. Her eyes, anything but. Focused, fierce, steady. The scrub top on her shoulders still carried faint locker room creases. But the badge on her chest now caught the light. Dr. Elena Johnson, Chief of Cardiothoracic Surgery. The silence wasn't just surprise. It was realization. They hadn't seen her. Not really. Not until now. For a moment, no one moved. It was as if the whole room had forgotten how to breathe. Then someone stammered, barely above a whisper, "Wait. You're the..." Elena didn't stop to answer. She didn't need to. Her voice was already rising with quiet authority. "I need vitals, imaging, and a team scrubbed and prepped in OR2. Now." The tone left no room for hesitation. Something shifted. Movement resumed. Voices snapped into motion. People scrambled to follow her orders. Just minutes ago, they hadn't seen her at all. Now, they couldn't move fast enough. Elena stepped out into the hallway, passing the nurse who'd handed her the mop just that morning. The nurse froze. Her face flushed a deep, shamed red. She opened her mouth like she might say something, but nothing came out. Elena didn't look at her. Didn't stop. There wasn't time for that. Not now. The patient in OR2 was dying, and she was the only one who could save him. Inside the OR, the atmosphere buzzed like an overloaded wire. A man in his 50s lay unconscious on the table, chest heaving unevenly under a pale surgical drape. The monitor nearby spat out jagged, irregular lines. The heartbeat was failing. Fast. Elena strode to the sink and began to scrub in sleeves rolled, fingers brushing, nails cleaned. Everything done with swift, practiced efficiency. Soap spiraled into the drain like tension draining from her mind. She had no time for anger, no time for pride. Not here, not now. From the other side of the room, a voice broke the stillness. "Your doctor, Johnson," said the young white surgeon standing by the table. His tone was part disbelief, part relief. Elena met his eyes, calm and steady. "Yes, I'll be leading the procedure." He blinked, swallowed, then stepped aside without a word, because this wasn't about hierarchy anymore. This was about survival. And every person in that room knew she was the best chance that man had. The room was tense, sterile, silent. The patient lay still on the table, a sheen of sweat on his forehead. His skin was pale, lips tinged blue. Monitors beeped in uneven rhythms, the jagged lines on the screen dancing erratically, signs of a heart in trouble. A nurse looked up, BP's crashing, 58/35, V-fib starting. Elena didn't flinch. She stepped to the head of the table, gloved hands ready. "Prep the valve replacement kit. I need retractors, suction, and exposure on the left side of the chest." Her voice was firm, measured, not raised because she didn't need to raise it. And just like that, the entire dynamic of the room shifted. Nurses moved quickly. Tools clicked. Gloves snapped. The energy changed from panic to precision. The young surgeon who had stepped aside now watched from the corner. His earlier confidence, the kind that comes with assumption, not experience, had melted away. His hands were clenched, but not from control, from awe and guilt. Across the room, the nurse who had handed Elena the mop earlier fumbled slightly while arranging the tools. Her hands shook just enough to be noticed. Her eyes avoided Elena's ashamed, humbled, quiet. But Elena didn't acknowledge her. Not out of coldness, out of focus. This wasn't the time for lessons. This was the time for life. The first incision was smooth, direct. Elena's hands moved like they had done this 100 times, because they had. Inside the chest cavity, the heart was swollen, trembling, barely holding on. Blood pooled. The valve had collapsed. To someone else, it might have looked hopeless. To Elena, it was clear. "Clamp here. Suction now. I need full exposure on this side." Each instruction came like clockwork. The team followed without hesitation, without question. The nurse who had doubted her now handed tools like they were lifelines, following every word, as if trying to make up for every assumption. Even the anesthesiologist leaned in closer, watching not just for vitals, but like he was witnessing something sacred. 10 minutes. That's all the patient had. And every second was a war. Elena didn't blink. She didn't breathe heavy. She just worked silent, focused, unstoppable. Time moved differently in the operating room. Each second felt stretched, thick with urgency. The heart monitor pulsed in chaotic bursts. Beep, 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 flat. The room held its breath. "Clamp the artery, now." Her voice cut through the tension like steel through gauze. "Suction on the left full pressure. Retractor in place." Blood spilled into the suction line. The patient's chest cavity, now open, revealed the damage in full ruptured valve, compromised wall, rising internal pressure. To anyone else, it might have looked like a case already lost. But not to Elena. She worked with the quiet intensity of someone who had stood at the edge of failure before and refused to fall. Her hands were swift, controlled, deliberate. Every suture pulled tight, every instrument handed over without delay. The young intern, who had once blocked her path, now stood just outside the glass window. watching frozen. Inside, Elena moved with unshakable calm. No panic. No pride. Just purpose. Across the table, the nurse, the one who had looked down on her, now handed her tools with silent care. Her hands were steadier now, her gaze following Elena's every move, not just out of necessity, out of respect. The anesthesiologist called out. Heart rate rising, 80, 95, 110, and steady. Elena didn't pause. She stayed locked in, finishing the final sutures. Valve is in, blood flow stabilizing. Prepare to close. Her gloved hands moved with the grace of a concert pianist, guiding the body back toward life. The machine that once screamed now clicked softly with the rhythm of survival. Beep, beep, beep. Steady, strong, alive. When the final stitch was placed, Elena stepped back. Her breath was even, her expression calm. The battle was over and she had won. No celebration, no grand speech, just a quiet nod to the team. Good work. Keep him monitored. He'll make it. And with that, she peeled off her gloves, slow, precise, like everything else she'd done, and stepped away from the table. Around her, no one spoke. Not because they had nothing to say, but because they finally understood. The tension in the room had vanished. In its place, stillness, a quiet that felt almost sacred. Monitors now beeped in calm, regular intervals. The air had shifted not because the danger was gone, but because they had witnessed something undeniable. Elena stepped back from the table. Her scrubs were damp. Her brow glistened with effort. Her eyes, steady as ever, scanned the team one last time. Vitals holding, said the anesthesiologist. Rhythm normal. BP at 100/60. The nurse at the instrument tray exhaled shakily, the same nurse who once looked down on Elena without ever knowing her name. She stepped forward now, hesitant. Dr. Johnson, she began. Her voice was small. I'm sorry. About earlier, I didn't. Elena met her eyes. Not with a glare. Not with pity. Just calm. Tired. Resolved. It's not your apology I need, she said quietly. And she meant it. This moment wasn't about guilt or revenge. It wasn't about proving anything. It was about a life saved, a man still breathing, and a room that would never be the same again. The OR doors swung open behind her with a quiet whoosh. Elena walked through them without looking back. No one stopped her. No one dared. Because now, for the first time, no one questioned who she was. They knew. Outside the operating room, the hospital hummed with life again, pagers chirping, carts rolling, voices murmuring through masks. But something was different now. The air felt lighter, like the whole building had taken a breath it didn't know it was holding. Nurses moved more deliberately. Eyes lingered just a moment longer on every name badge they passed. There was a stillness, not of fear, but of awareness. The story had already begun to spread. They thought she was a janitor. No, she's the chief of cardiothoracic. She saved him. Without blinking. In the recovery wing, the patient, a 52-year-old schoolteacher named Mr. Levington, lay under warm blankets, his chest rising slowly but evenly. The color had returned to his face. His vitals were strong. He was alive. Because of her, a post-op nurse whispered to her colleague, he wouldn't have made it without that surgeon. What's her name again? The assistant replied without looking up. Dr. Elena Johnson. Back in the surgical wing, hospital leadership had assembled in haste. Dr. Holland, the medical director, a tall man with silver hair and a clipboard always in hand, stood at the front of the hallway. Doctors and nurses lined the walls, still in scrubs, some with hands clasped behind their backs. His voice was official, but there was a new weight to it. I want to formally commend Dr. Johnson for her leadership during today's emergency. Her actions under pressure saved a life. Let it be clear she is one of the best surgeons on this team. and I expect that to be reflected in the respect she receives. A few claps started, polite, a bit awkward, then stronger, sincere. Elena, standing quietly to the side, nodded once. She didn't need a speech. She didn't need applause. She just wanted them to see. The hallway cleared slowly after the announcement. Doctors returned to their rounds. Nurses pushed carts through open doors. Conversations faded back into routine. But something had shifted. Not in Elena. In them? Now, when she walked down the corridor, heads nodded. Doors were held open. Interns who had once avoided her gaze looked up, some embarrassed, some thoughtful, some unsure how to undo what had already been done. She didn't expect apologies. She didn't need validation. She had the life she saved. She had the truth she lived, and that was enough. A few minutes later, as she stood reviewing post-op charts, she heard soft footsteps behind her. She turned. It was the nurse, the one from earlier. No cart this time, no mop, just hands clasped tightly in front of her, shoulders a little hunched, voice almost a whisper. "Dr. Johnson," she said. Elena waited. I wanted to say I'm sorry. For earlier. For assuming." The words hung there raw, quiet, real. Elena studied her for a moment. The nervous breath, the clenched fingers, the way she didn't look away this time. Then Elena closed the file in her hands. Her voice was calm, firm, not cruel. "Next time," she said, "look at the name badge first. Not a lecture, not a scolding, just truth." And now it was hers to carry. Later that evening, as Elena walked toward the elevators, she passed a janitor, an older black woman with silver-streaked braids and a slow, steady stride. They locked eyes for just a second. The janitor gave a small nod, not of surprise, not of apology, but of knowing, the kind of nod that says, "I saw what they didn't, and I've lived it too." Elena nodded back. No words were needed, because now, for the first time that day, the whispers were gone. All that remained was respect.